So the disease was considered eliminated from the U.S. in the year 2000. Now cases are at a 33-year high. There are now almost 1,300 confirmed cases of measles across 38 states, according to the CDC, and that's just this year alone. 3 people have died so far, 2 kids and 1 adult, all unvaccinated. Now, a reminder, the MMR vaccine is about 97% effective at preventing the illness, something to keep in mind. Let's bring in our ABC News medical correspondent, Dr. Darian Sutton. All right, Doc, we've had measles vaccines for decades. So why are cases so high right now?
Well, Kira, this is so much more than a surge in cases. This is a sign of a deep fracture within that protective wall that has been built by public health professionals that has taken close to over 25 years to help prevent these types of outbreaks. Unfortunately, as we've seen in the recent years, there's been a steady decline in the percent of children that have been fully vaccinated or have been participating in their routine vaccinations, now just under 93%. Now, that might not seem like a big difference from that protective number that we need of 95%, but that's also equivalent to 280,000 children that are currently in kindergarten that are not up to date on their vaccines. And as you've seen, it only takes 1 child to begin an outbreak. So those are some of the main reasons why we are seeing these numbers that we're seeing today, because it's an important reminder that measles has not changed. The virus has not stopped doing what it's continued to do, but the public health protection that we've had the benefit of, unfortunately, is waning.
So how are public health officials responding to this many cases?
Well, I've seen how public health respond to these cases. I've worked during 2019 in our outbreak where we saw the highest number until we've beaten it recently today of measles numbers. We understand that when these outbreaks happen, you want to start by testing as much as possible, communication in terms of how to prevent infection, and reminders on the most effective and the safest way to prevent an infection, which are by vaccines. And so that work is likely being done on the ground. We're seeing more and more of this communication. But Kira, it's important to understand that although we're focused on the epicenter that happened in Texas, there are small embers that we're seeing all over the United States. And unfortunately, there are other pocket communities that are under-vaccinated, a lot lower than 90%. We're talking about 70%, even as low as 65%. That are at risk. So it's so important to understand that especially if you are in these communities where you are surrounded by people who are not vaccinated, that you're aware of your risks and to make sure to talk to your provider about how to protect yourself.
All right, Dr. Sutton, well, the measles are much more than just a rash. 3 people have already died this year, as we mentioned up top. Tell us what to do if you come in contact with someone who has the measles, whether you're vaccinated or not.
I'm so happy that you said it's so much more than just a rash, and you're absolutely right. I've seen the complications with patients that have suffered in 2019. We're talking about pneumonia or infections of the lungs, encephalitis or inflammation of the brain, and even complications that can develop 7 to 10 years after the infection has resolved. Complications like panencephalitis, which is a deadly brain disorder. So it's so important to understand, as you said, it is so much more than just a rash. So number one, remembering that the most effective and safest way to protect yourself is with the vaccination. These provide lifelong immunity up to 97%. If you've been exposed and you are vaccinated, I want to help provide some calm. I would advise just being mindful of symptoms, cough, conjunctivitis or redness of the eyes, fever, and of course, a rash is what you want to pay attention to. If you have not been vaccinated and you think you might have been exposed to measles, I would suggest you quarantine and isolate. Measles is so contagious that if you are not vaccinated and you are exposed, you have up to a 90% risk of getting that infection. So it's so important, again, to remember the most effective and safest way to prevent that infection is by vaccination.
All right, Dr. Sutton, appreciate you. Thank you so much.